Greetings. Today is the 3rd of April 2020. I have some updates on the coronavirus in Germany, New York, and Spain. I also have a story about a coronavirus so-called truther that was sentenced to 3 months in jail in the UK. I'll start with Germany. Germans risk being fined up to €5,000 for standing too close to each other from today, as officials crack down on people flouting rules brought in to control coronavirus. Chancellor Angela Merkel's government has ordered people not to leave their homes unless they have an exceptional reason, such as grocery shopping, exercise, or medical appointments. Gatherings of more than 2 people are banned, and a distance of at least 5 feet (1.5 meters) must be kept from others at all times. Local governments have power to set fines for transgressors, with city officials in Berlin saying the fines would be as high as €500. Similar announcements have come from across Germany's 16 states. Bavaria, Germany's largest state, has been the worst affected by the coronavirus so far, with more than 18,000 cases. There, people who stand less than 5 feet apart risk being fined €150. The crackdown comes as Germany's death toll from coronavirus broke through 100,000 today, while the number of infections reached nearly 80,000. The Robert Koch Institute announced another 145 deaths in its latest figure this morning, a similar jump to yesterday's 140 and Wednesday's 149. It brings Germany's death toll from 872 to 1,017, with a mortality rate of 1.3% of cases, a figure which is still low but is rising relentlessly. The total infection count rose by 6,174, marginally higher than yesterday, taking the tally from 73,522 to 79,696. This is a statement from Angela Merkel.
Es ist ernst. Nehmen Sie es auch ernst. Seit der deutschen Einheit, nein, seit dem Zweiten Weltkrieg, gab es keine Herausforderung an unser Land mehr, bei der es so sehr auf unser gemeinsames, solidarisches Handeln ankommt. Ich versichere Ihnen, die Bundesregierung tut alles, was sie kann, um die wirtschaftlichen Auswirkungen abzufedern und vor allem um Arbeitsplätze zu bewahren. Wir können und werden alles einsetzen, was es braucht, um unseren Unternehmen und Arbeitnehmern durch diese schwere Prüfung zu helfen.
Okay, now to New York. A shocking picture showing a New York City subway train packed full of people last night, despite the coronavirus lockdown, has been shared on social media. The number 2 train, which is said to have been photographed around evening rush hour at 6 p.m, is shown full of mask-wearing passengers crammed together, unable to avoid close contact with others. New York City is currently under a full stay-at-home lockdown, but key workers such as healthcare workers still have to travel in order to fulfill their vital roles in the battle with coronavirus, while poorer workers unable to leave their jobs still take the risk. But it's interesting, in this photograph you can actually see a couple of people here that have no masks or disposable gloves. Well, I can't really see if they have disposable gloves, all of them, but there's just some people that just could care less basically about catching it themselves or spreading it to other people. I think there's a lot of people that aren't actually taking it too seriously, which is can be deadly. However, this is leading to scenes such as this, where a number of people who have potentially been exposed to the virus are packed into subway cars to get to work, increasing the risk of infection from the coronavirus. The MTA says it is running as many trains as it can, but has been hobbled because of crews that are out sick or quarantined. The World Health Organization advises anyone with symptoms self-quarantine for 14 days. The Post continued, public health officials have said social distancing is key to slowing the spread of the deadly COVID-19, and New York remains the hardest hit place in the nation. The New York subway was photographed by the DailyMail.com on the 31st of March, and the picture shared on Instagram shows the situation hasn't improved since. Official advice suggests that people keep a distance of 6 feet from others in the event that they must leave their homes, which is clearly impossible for passengers in this packed subway train. Generally, subway use in New York, which often looks like the picture during rush hour during normal times, has plummeted. On the 30th March, the New York Times reported that ridership is down by 87%. However, particularly in poorer neighbourhoods, the subway is reportedly still being used by those who feel they cannot leave their jobs and must instead risk catching the coronavirus by using the subway. The city is taking a number of other measures to deter social gatherings, banning groups of people, taking down basketball hoops, and sending in police to break up gatherings. Yesterday, there were 8,669 new cases of coronavirus in New York, an increase of 9%, bringing the total to 92,381 and 432 additional deaths, an increase of 8%, bringing the state death toll to 2,373. The worst of the virus is yet to hit New York. Various models project different dates for it, but it is expected in between 7 to 30 days. New York Governor Andrew Cuomo said on Thursday that the virus was going to then, quote, march across the country, unquote, wreaking havoc on rural communities just as it has in his state. He is begging for more equipment and ventilators, but says it is unclear where they will come from. Once the state's stockpile of traditional ventilators runs out, it will start relying on the backups of improvised anesthesia and BPAP machines. Patients will also start sharing ventilators in some cases. Speaking at the press conference where his brother CNN anchor Chris Cuomo, who has coronavirus, was videoed in to share his experience, the governor said he is hopeful it is a strategy that will work, but that the, quote, burn rate is troubling. Quote, at the current burn rate, we have about 6 days of ventilators in our stockpile, meaning if the rate of usage, people coming into hospitals needing ventilators, if that continues, we have about 6 days. If the apex happens within that time frame, increase is longer, we have an issue with ventilators, he said. He added that on average 350 people a night are showing up at emergency rooms requiring ventilators. If they do not get one, they die, he said. Quote, that is the blunt equation here, unquote. As you can see also in this photograph, there's 1, 2, 3, 4, 5 people with no masks on. So people are being really irresponsible. Okay, we'll go on to Spain now. I'm just scrolling up to the top of the page here. Spain's rate of growth in coronavirus cases fell to a new low for the second day running today, in the latest promising sign that the crisis could have peaked. The Spanish Health Ministry announced 7,472 new cases today, bringing the country's total from 110,238 to 117,710. The 6.8% increase is the smallest since the crisis began, improving further on yesterday's record low of 7.9%. Meanwhile, another 932 people have died after being infected, slightly down from yesterday's 950, bringing Spain's death toll from 10,003 to 10,935. According to the latest figures, more than 2,000 of the latest infections were in the Madrid region and another 1,650 were in Catalonia. Spain says that 30,513 people have recovered from COVID-19, while 10,935 have died. The Spanish death toll is the second highest in the world, behind only Italy, and has risen rapidly after the first fatality was reported only on March the 3rd. However, the slowing infection rate has been hailed as an encouraging sign, suggesting that lockdown measures may be working. Cases surged by 18% as recently as March 26th, but the figure has been above 10% only once in the last 6 days. Yesterday it fell to a new low of 7.9%, and today's figure of 6.8% is more promising still. Quote, "There's light at the end of the tunnel," unquote, Health Minister Salvador Illa told Parliament. Quote, "A glimpse of hope. The curve has stabilised. We have reached the peak of the curve, and we have started the slow down phase," unquote. Spain has been on lockdown since March the 14th, and restrictions have since been tightened, with non-essential workers asked to stay at home from March 30th. The country has shed an unprecedented 900,000 jobs since the measure started, with temporary layoffs affecting at least 620,000 other jobs. Around 80,000 workers are off sick with coronavirus, while 170,000 more are on sick leave, isolated after coming into contact with an infected person. Deaths in nursing homes, where older people are particularly vulnerable to the disease, have attracted particular attention in Spain. The head of government for the Madrid region told Spanish radio that around 3,000 people had died in nursing homes in March, 3 times higher than normal. The regional government says it cannot be sure how many were caused by coronavirus because of a lack of testing equipment. 50 residents have died since the start of the epidemic at one nursing home in Leganés on the outskirts of Madrid, EFE news agency says. Funeral workers in white protective gear were seen taking coffins out of the nursing home and putting them in a van. Later, ambulances picked up various uninfected residents to take them to other homes. A senior pharmacist in the Madrid region has asked the government to supply protective gear like after at least 5 pharmacists died from the virus. About 270 pharmacists are in quarantine in the region because they have symptoms of the disease, forcing the temporary closure of dozens of pharmacies. Luis Gonzalez said during an interview with Private Telecino. Quote, all I ask is that we please be sent medical supplies as soon as possible. We are also healthcare workers. We are on the front line of the fight. We are working with the public, unquote, he said. Quote, we are not seeking subsidies. We are not asking for economic aid. We only ask for protective gear so we can continue providing our service. So no more pharmacies close. Okay, we go on to the UK now. To this idiot. A quote, COVID idiot, unquote, who wandered around his local hospital to see the impact of coronavirus and posted about his visit on Facebook, has been jailed for 3 months. Kieran Stevenson, 32, was captured on CCTV at Stoke Mandeville Hospital in Buckinghamshire after posting on social media that he was going to go walk around the hospital to see the extent of the coronavirus pandemic for himself. He posted photos on Facebook of himself at the hospital on March 30th and images of the hospital corridors, and commented that staff were not taking safety measures seriously. Stevenson's from Aylesbury Bucks was arrested and charged with 1 count of causing a public nuisance and 1 count of contravening the requirement as to the restriction of movement during the coronavirus emergency period. Thames Valley Police say he posted on social media saying he had attended numerous parts of the hospital without a medical need to do so when it is treating COVID-19 patients and is closed to visitors and those with non-urgent appointments. A spokesman said, quote, his actions within the hospital is not complying with the government's restrictions, caused considerable distress and disruption to the hospital staff and members of the public, unquote. He appeared at Oxford Magistrates Court on Thursday, where he pleaded guilty to both charges and has been sentenced to 12 weeks imprisonment. He was also ordered to pay £300 compensation to the NHS Trust. Investigating Officer Detective Chief Inspector Lewis Prescott Mailing of Aylesbury CID said, quote, Stevenson's actions were reckless in attending the hospital without a genuine medical need. Quote, he has ignored the government advice, declared signage at the hospital and caused upset to members of the public and NHS staff following his social media posts. In doing so, he breached the law. Quote, at this time we must protect the vulnerable in our communities and do all we can to support the NHS. Thames Valley Police will consider any offences and take the appropriate action in order to play our part in achieving this. The overwhelming majority of people are acting sensibly, and we have not taken this decision to arrest Stevenson lightly, but we believe this was necessary and proportionate given his attendance at the hospital. The court ruled his actions were a brazen disregard for law which is there to protect lives, and these could only result in a custodial sentence, unquote. The local police area commander for Aylesbury Vale, Superintendent Michael Lusenberg, said, quote, the vast majority of our communities are following the government guidance and we hope this is an isolated case. Quote, we will be visible in our communities, engaging with the public, explaining the restrictions in place and encouraging compliance. Where necessary though, as in this case, we will take enforcement action to protect the NHS and the wider public, unquote. Now there's lots of people that are doing this. They're going into hospitals and filming, and you know, they believe the whole coronavirus is a hoax, and I'm not quite sure what they're hoping to prove they're putting medical staff and administration staff in danger, just because they don't believe the coronavirus doesn't exist. It's totally irresponsible to put others at risk. And I wonder if these people are actually wearing masks and disposable gloves when they go into these hospitals. No doubt they don't, because they believe that the coronavirus is a hoax. And I'm quite angry over this, actually, because I've two family members that are on the front line. And one of those family members, along with their spouse and their three children, had to go into self-isolation because one of this caretaker colleagues was unwell, and so anyone that had been with this person had to go into self-isolation. Both are okay, the colleague and my family member, and they're out of self-isolation. I also have another family member that works in the community caring, and they're basically risking their lives, every single day that they go out into the community to care for certain people. And we as their families also are at risk too of catching the coronavirus. I'm hitting 60 now, so I'd be up there, of someone that would definitely catch the coronavirus. But my family member and myself have discussed this, and because the work that they do is so important and so vital to the community, that we felt it was very important that they continued to do the work that they're doing. And it's interesting because only about 4 or 5 weeks ago, a certain group on the left reported that family member and tried to get them fired from their job because of basically my politics. And I'm just wondering, as this family member is out there risking their life, what these people are doing, probably sitting at home comfortable and safe. So there you go. So look, listen, until next time, take care of yourselves, look after yourself, look after your families, and just stay safe. Until next time, take care and God bless.